She's personally cared for or supervised the nursing care of women and their families during pregnancy and even before they became pregnant. She cared for women as they brought a new child into the world on labor and delivery. She cared for their newborns during the first hours and days of their life. She cared for recovering moms and nervous dads. And it takes a special person to both choose and want to work with this population of patients, because one doesn't have a single patient to care for. One has a family unit, however that can be defined by today's standards. It can be a single mom, a family with their firstborn child, nervous about how to care for their baby, a mom with a deployed spouse, a family with a special needs baby, or sadly a family experiencing perinatal loss, or a family unable to conceive but desperately wanting to. Lieutenant Commander Wagar is an expert in caring for and helping to create healthy families. This beneficiary population is so critical within Navy medicine. The Navy certainly needs critical care nurses, emergency room nurses, and operative nurses. But nurses with the skills and expert training that Amy possessed and sharpened are so very crucial for the physical and the mental well-being of our forces. Amy's cared for spouses and dependents while their husband and fathers were deployed, playing a very pivotal role in the mental well-being of those deployed members. I have faith that they were able to perform their demanding jobs while away from home because Amy was there caring for and supporting their dependents. Her reputation in this area was so recognized that she was selected as the chairman of the Navy Medical Center Portsmouth Perinatal Advisory Board. This is a body of individuals who advise and report to the Bureau of Medicine and Surgery in Washington, D.C. regarding perinatal care. She was chairman of the board at the medical center where the most yearly births in the Navy consistently occur. And this, ladies and gentlemen, was no small feat, and it wasn't even her full-time job. I'll sidetrack for a moment just to give you a little picture of what Amy's full-time job was. She was the CNS, as you heard earlier, for the mother baby unit in complicated antepartum GYN inpatient wards. And technically this can be summed up to state that she ensured that evidence-based nursing practice and policy was taught and implemented by competent staff on the busiest inpatient units at Navy Medical Center Portsmouth. I mentioned that this facility consistently has the most births in the Navy. So I gave you a technical definition, but to break that down into a day in the life of the mother baby unit, in a nutshell, this meant that for a 29-bed ward, the staff could have 10 to 20 new moms and babies admitted each day. And we have to multiply this by 2 because there's the mom and the baby. So that equals 20 or 40 new patients admitted every day. And because the average inpatient stay is 2 days, this means that there are about as many patients coming as there are going on a daily basis. So if you did the quick math, you're probably thinking, you said it was a 29-bed unit. How did, all these patients fit there? Well, actually there were 29 rooms, but in many of those rooms there were 2 beds. And although the unit had a priority to try to give private beds to every new mom, sometimes that wasn't always possible because of Mother Nature, if there was a surge in births. So Amy was very instrumental in carefully and expertly orchestrating the care and patient flow for this unit, sometimes doubling up 2 moms in one room, but only for a few hours until one was discharged. All of this required careful consideration for each patient, the date and time of birth, the date and time of anticipated discharge, and it just went on and on. Most of the time it worked out very well, but when it didn't, Amy would give the word to advise the opening of an overflow mother-baby unit to support the promise of those private rooms that I told you about. And I won't go into the steps that had to be in place to open that unit, but trust me, she did, and she performed them flawlessly. She also had the immense responsibility of ensuring the appropriate orientation and competency for all the staff on this unit. Military members spend an average of 3 years at a command, so 1/3 of them at any given time are moving and changing duty stations. And there are probably another third that are moving within the command to vary their clinical experience. So by rough estimate, there's a 2/3 turnover of each staff per year on the units without the challenge of deployments, staff illnesses, and other staff issues. So I think you may be getting just a little bit of the picture of the responsibilities of a day in the life of Lieutenant Commander Wagar.